So, good morning everyone. Thank you for the opportunity to speak today. My name is Dr. Gemma Proudfoot-Jones. I'm an early phase clinical research fellow at Clatterbridge Cancer Centre, Liverpool. And today I'll be talking about the ATTAINMENT Study, which is a study that I act as sub-investigator on. I look after the patients at our centre. And the chief investigator is Professor Dan Palmer, who's the ECMC lead. It's a multi-centre study that's recruiting patients across the UK, including Liverpool, Manchester, Glasgow, Edinburgh, and Oxford. The study is a modular phase 1b trial of MDX124, which is a first-in-class annexin A1 targeting antibody in patients with advanced solid tumours, including cholangiocarcinoma. So to begin with some background on annexin A1, annexin A1 is an immunomodulatory protein that's overexpressed in the majority of cancer types. And we've been able to show that high expression correlates with disease activity and poor patient survival. It's secreted from tumour cells and undergoes a conformational change that allows it to interact with 4-malpeptide receptors, namely FPR1 and FPR2, on tumour cells and immune cells. And by activating these receptors, it triggers several downstream oncogenic signaling pathways, including promoting tumour growth and proliferation, angiogenesis, migration, and drug resistance. It also helps shape the immunosuppressive tumour microenvironment in cancer by activating several immune cells, including Tregs, T helper 17 cells, the immunosuppressive M2 macrophages, and myeloid-derived suppressor cells. So MDX124, this new drug under study, is a first-in-class humanized IgG1 monoclonal antibody, which is specific to the secreted form of annexin A1. So how does MDX124 work? It targets, as I've said, the secreted form of annexin A1 and thereby blocks the interaction with the FPR1 and 2 receptors, so prevents these downstream oncogenic cell signaling pathways. In preclinical studies, it's been shown to target these oncogenic signaling pathways in several mechanisms. Firstly, it reduces cancer cell growth via cell cycle arrest. It impairs cancer cell migration and metastasis. And it activates the immune system by triggering the antibody-dependent cell-mediated cytotoxicity by NK and macrophages, and therefore leads to the elimination of cancer cells. So now on to the study design for ATTAINMENT. It's a modular phase 1b study, which is evaluating MDX124 in advanced metastatic solid malignancies which have been shown to overexpress annexin A1. It's split into 2 modules. The first module is a single-agent dose escalation study using Bayesian statistics with an expansion cohort. And the second module is a proof-of-concept study in specific cancer indications as monotherapy and in combination with standard care treatments. These include cholangiocarcinoma and gallbladder cancer, where it's being used as monotherapy as second line in locally advanced and metastatic disease. And secondly, in pancreatic cancer, where it's being used in combination with first-line treatment, gemcitabine and Abraxane. There's also some additional indications under consideration for Module 2, and this includes things like triple-negative breast, prostate, and osteosarcoma. So now on to the objectives for ATTAINMENT. The primary objectives for Module 1 are to determine the recommended phase 2 dose when it's given as a single agent. And for Module 2, it's to assess the safety and tolerability of this drug in selected tumour types when it's given on its own and in combination. Secondary objectives are to assess the safety and tolerability of MDX124 when given on its own in Module 1, and also to characterize the pharmacokinetics and to assess any anti-tumour activity of MDX124 alone and in combinations. There's also several exploratory or translational objectives. Firstly, to look at the relationship between the dose and biomarkers both in blood and in the tissue, and this includes annexin A1 expression. And also to look at the host immune response to MDX124, including developing an assay to measure drug antibodies, to look at its immunogenicity, and to measure how it affects the immune system by characterizing with immunophenotyping. So looking now at the participant characteristics and the safety in ATTAINMENT. So in the dose escalation cohort in Module 1, 21 patients were treated with MDX124 at doses ranging from 1 to 30 milligrams per kilogram, with dosing occurring every 2 weeks. The median age was 60 years of age, and the patients were quite heavily pre-treated with a median of 3 prior treatment regimes. Treatment-related adverse events were seen in 62% of patients at the data cutoff, and the most common of these were fatigue and nausea. You can also see in the table on the right-hand side the other treatment-related adverse events which occurred. There's some other GI toxicities and some liver derangement. But notably, there were no grade 3 or above treatment-related adverse events in any dose level which was evaluated. There were also no treatment-related serious adverse events and no dose-limiting toxicities observed to date. There's also been some preliminary anti-tumor activity shown in ATTAINMENT. Overall, the disease control rate was 35%, and in the evaluable patients, it was 55%. These were the patients who'd received 4 cycles of treatment and had a CT scan post-baseline. These can be shown on the right-hand side of this graph and included 1 confirmed patient that had a partial response who had cholangiocarcinoma, 4 stable disease patients, and 1 patient who had a non-CR, non-PD who didn't have measurable disease by RECIST. Notably, the disease control and tumour shrinkage with monotherapy was shown in 3 out of 4 evaluable cholangiocarcinoma patients. So given these positive early signals in cholangiocarcinoma, Module 2 is now looking at MDX124 monotherapy in second-line cholangiocarcinoma and gallbladder population. The inclusion criteria here was that the patients had to be previously treated with first-line treatment gemcitabine and cisplatin, plus or minus durvalumab. Patients that had received more than 1 line of treatment in the advanced care setting were excluded, but patients who had been treated with prior adjuvant or neoadjuvant treatment with targeted treatments like IDH1 or FGFR2 inhibitors were not excluded. Patients are undergoing biopsies prior to cycle 1 and after cycle 4 for biomarker analysis. And so this includes looking at Nexin A1 expression. And hopefully this should shed some light on why some patients respond and others don't. And by doing pre-cycle biopsies rather than archival biopsies, it should give us a more accurate insight into biological changes post-treatment. I'd like to finish by going through a case study. So this was a patient who was a 52-year-old gentleman with cholangiocarcinoma, which was metastatic in liver and lymph nodes. He'd had prior lines of treatment, including gemcitabine and cisplatin as neoadjuvant treatment, and had then gone on to have capecitabine and radiotherapy. He started treatment on the ATTAINMENT trial in February 2024 and was receiving the dose of 10 milligrams per kilogram every 2 weeks. He remained on study for around 12 months and received 19 cycles in total. He had a confirmed partial response achieved with MDX124 monotherapy with a 36% reduction in target lesion size observed. He also had no DLTs and no treatment-related serious adverse events. So to conclude, the preliminary data from ATTAINMENT is very encouraging, showing encouraging safety and tolerability profile of the drug and anti-tumor activity of MDX124 at doses up to 30 milligrams per kilogram given 2 weekly. The disease control rate of 55% in evaluable patients is very positive, and there's also a disease control rate in the evaluable cholangiocarcinoma patients of 75%, with 1 confirmed partial response. There was no grade 3 or above treatment-related adverse events or dose-limiting toxicities. So the overall safety profile supports the combination of MDX124 with other therapies. Module 2 is currently ongoing and enrolling patients, looking at MDX124 as monotherapy in cholangiocarcinoma and gallbladder patients. So thank you very much. I'd like to say on behalf of the trial sponsor, Medinex, the investigators and the other study teams, thank you very much to the patients and their families and their caregivers for participating in the ATTAINMENT trial. Without their participation, none of this would be possible, and I'd like to thank the AMMF for their support. Thank you.